The AVETUX trial was very interesting, albeit small clinical trial where we treated microsatellite stable patients with metastatic colorectal cancer with chemotherapy plus EGFR inhibition plus Avelumab. This was a completely RAS wild type cohort, of course, and since it was a single arm trial, we cannot really say anything about other than cross study comparisons about the efficacy of this 3-component regimen. But what we noticed in this trial is that patients that had a certain type of high affinity Fc gamma receptor on their NK cells, these patients had a superior therapeutic pressure on treatment. And this showed, this kind of was reflected by the selection of PD-L1 abrogating mutations. So we found in that trial and also in another trial that we studied afterwards, the selection of specific variants of PD-L1 on treatment that actually completely abrogated membrane expression of this molecule. You have to know, if you want to understand that data, that Avelumab is not a simple checkpoint blocker that blocks the interaction of two checkpoints, but this drug has a functioning Fc part, and this is why it can attract immune cells, and it can also produce ADCC, so antibody-dependent cytotoxicity, directly on the cancer cells. So it's both a passive immunotherapy and a checkpoint blocker. So the reason why we found these PD-L1 abrogated subclones was that the selective pressure of this antibody directly on the tumor cell led to this escape mechanism. The problem with this escape mechanism from the tumor cell is obvious. If it loses PD-L1, it is very visible by the immune system. It gets a visibility that it hasn't had before. And so what we found in these mutants was that they were kind of fluctuating at a low level for a long period of time because these clones that were mutated, they kind of evaded the selective pressure of this antibody, but at the same time they were suppressed by the T cells in their environment. So for us, I mean, it was a very nice biological study to understand a little bit these determinants of resistance. But it doesn't have a clear clinical implication as of now. I mean, since it's a mechanism of resistance that is kind of really mitigated resistance, I believe that the patients that have this high affinity Fc gamma receptor and that are prone to developing those mutations are in fact the ones that long-term benefit from the drug. So we are currently also working on a study protocol for this specific subset of patients with metastatic colorectal cancer in order to really find out if the combination of Avelumab with chemotherapy and targeted therapy would be most beneficial in this subset of patients, but this still needs to be seen and tested in prospective trials.